Hi, Miss Maule. Can you start off by just introducing yourself?
My name is Patricia Maule, a DNP. Finished my doctorate in 2015. I specialized in oncology for the last 22 years.
Where are you from?
I'm from the south side of Chicago. I currently live in Indiana.
And how do you typically start your mornings?
Coming into the city, anticipating the commute, and then getting parking garage, walking to office, and then just kind of really to hit the ground running. Grab the schedule in our kit bag and off to clinic.
Wow. Or how long is your commute?
About an hour,
Oh,
45
okay.
minutes to an hour, so not too
Okay.
bad.
How do you relax after a long day of work?
Just trying to stop thinking and stop talking. And really just, maybe social media for a little bit, music. I have a small dog at home, so just kind of trying to not think about work, to let your mind rest.
Right. What specialty or subspecialty are you in and why?
So as I mentioned, advanced oncology nurse practitioner, so it's general medical oncology, but then I ended up now specializing in thoracic oncology, which is pretty much specifically lung cancer.
Right. And what type of patients do you usually see, do you say?
Age range or
Yeah,
just,
age
yeah,
range.
so our panel, I mean, we can't see any adult patient, but our panel, the one I see with Dr. Che, is typically, I would say ranges from 40s into the 90s. So they are all adult patients.
And going on, can you share one memorable experience you had with a patient?
Oh, well, I don't know that there's one in particular that I can think of right now, but I can tell you in general things that continue to occur to me. We become so routine in what we do day in, day out. This, patient after patient, cancer after cancer, but these are people. And I think really what I take away or what I remember the most is how they look or respond when you really make a connection with them. And that just really facilitates everything else that we have to do to really share genuine care and concern. And then that's just kind of, you can just see the walls come down. They're coming in, they're frightened, they don't know what's going on. And then you make that human connection, and it just facilitates everything.
Thank you. And can you share a memorable experience with a patient's family or a friend?
So that too, kind of similar, just building trust, and letting them know that you're there too for their family member. And then letting them know that they are doing a good job, they are doing okay, because they, I think, second guess themselves. If they could take better care of them, they would get better, if they, things like that. But to just be there for them and support them. And that's what I take away, again, is making that connection, that it's genuine care.
Can you share a memorable experience you had with a fellow healthcare professional, a nurse, doctor, anyone really?
One in particular from a physician I worked with very early on in my career, first getting into cancer and having to relay bad news, which is often, what we do, and not knowing how to handle it. So his kind of wise guidance was really kind of, it may have sounded harsh initially, but I've reflected on it often. And he said, when you're in cancer and you have these diagnoses, we all know they're going to die. You don't have to kill them today. And that has stuck with me. So it's just it makes me think what we're saying, how we say it, when we say it. and when we need to change what we're saying. And I think if you, again, establish that relationship and trust with the patient and the family, you can kind of gently guide them to where you need them to be when the bad news comes. So that would be the one from a physician that has stuck with me.
Thank you for sharing. Going on, in your opinion, what are some characteristics that make a good healthcare professional?
Well, certainly empathy, honesty, really being genuine, warm, friendly, and I don't think you can look at this as just a job. You have to bring the person to it, or the human to it. It can't just be, in at 9 and out at 5. There's more to it than that. And patients pick up on that.
Yep. What aspects of practicing medicine do you find most challenging?
Patients and their families and trying to get them where you need them to be.
Right.
But I think through education, teaching them and then kind of leading them will help. So everybody, you can get everybody on the same page, but they have to understand it. And then navigating the system, the finances, the drug costs, things like that. It's just an never-ending battle, if you will.
Right. What aspects of practicing medicine do you find most rewarding?
Patient contact, really helping someone, or again, in oncology, we're not curing everyone, but to make them feel better, to make the pain go away, to make the nausea stop, just making them feel better and making them feel safe.
And how do you collaborate with other healthcare professionals?
So that is just nonstop. It is, phone calls, text messages, email messages, meeting each other in the hallway and, grabbing 2 seconds to talk about this case or that case. Just ongoing, open discussions.
Right. And how do you build trust with patients in your care?
Me personally, I make sure that I keep my word first and foremost. If I tell them, they need help at home, we're going to call in this resource or that resource, to make sure that I do that and then follow through on it, to help make sure that it does happen. Just, anticipating their particular characteristics and being ready for them, and showing interest in things that you have learned from previous visits, to just convey trust and that them as a person, that they're not just a number or a case.
Right.
You may remember their dog's name, or where they went on their last vacation.
Yeah. Do you have any special tips or tricks when caring for patients?
I think, try to keep it light, and I try to gauge them first, and then that way I can kind of gauge my presentation to them for whatever we're going to go through, typically in the initial visit, where you don't really know a person. Just warm, try to add a little humor to the situation. I think that can kind of reduce everybody's anxiety, and it lets them know that you're not a machine, that you're a person.
What is the greatest lesson you learned from your overall medical experience?
Just to never say never. If you may have seen it 100 times, the time you assume that this will be the outcome will be the time it is not. Due diligence, and never assume anything.
Right. What is a challenge you feel that healthcare professionals face today?
Oh, an ever-growing population, too many patients, not enough caregivers, not enough resources, a very rapidly changing world where there are probably socioeconomic disparities that kind of inhibit everyone from benefiting from those advances, and just, again, not enough time or personnel to distribute that or disseminate that for everyone.
Right. And what is one piece of advice you have for aspiring healthcare professionals?
Perseverance. You know, if it were easy, everyone would do it.
Mm-hmm.
You know, just you don't give up.
Yeah.
That's pretty much it. Just persevere.
Thank you so much for your time.
Thank you.
We really appreciate getting to learn from you.
Thank you.
Thank you.